Welcome to Piano Keys Academy. I'm Dr. Michael Finley, and this is another episode of Anatomy Center. Today, we're diving into the importance of the ulnar nerve and its role in piano playing. This vital structure is very susceptible to injury, so understanding its function, its location, and its most common compression points is an important part of avoiding injury at the piano. Let's explore the path of the ulnar nerve. The ulnar nerve starts at the base of the neck. Let's zoom out a bit and look at the entire structure of what's known as the brachial plexus, or the network of nerves that innervates the entire arm structure. This structure emanates from the spinal cord at the base of the neck, where it joins with the thoracic spine. Spinal nerves C5 to T1. As you can see in this illustration, the ulnar nerve is fed by the bottom of these two roots, namely C8 and T1. From there, the ulnar nerve travels underneath the collarbone, moves through the armpit area, and continues down the arm. It then passes through two important tunnels at the elbow and wrist, known as the cubital tunnel and the Guyon's canal, respectively. This nerve is crucial for movement and sensation in the forearm and hand, particularly affecting the pinky and ring fingers. Unfortunately, the ulnar nerve can get compressed at several points, especially the neck, shoulder, elbow, and the wrist. Such compression can lead to pain, numbness, or even muscle weakness in the hand, impacting your ability to play. So let's start from the neck and work our way outwards. One of the most common posture problems among musicians of all stripes is forward head position. Of course, this isn't just limited to musicians. People who do desk jobs or practically anyone with a smartphone is highly susceptible to this behavior. But just look at what this position does to the body. In the injury prevention lectures I give around the country, I like to point out the impact of head position on the muscles of posture. But another huge impact this has is that it compresses the origin point of the entire brachial plexus. So it's not just the ulnar nerve that's affected, but all of the nerves that serve the entire arm structure, including the upper arm, the shoulder, the upper back, etc. So keeping your head balanced on top of the spine is a crucial part of achieving good posture, period, but especially at the piano. Moving on to the shoulder. The ulnar nerve, along with the rest of the brachial plexus, passes between the collarbone and the shoulder blade through the armpit area and along the pinky side of the arm. Another place it can get compressed is right here where the three bones of the shoulder complex come together, the clavicle, the scapula, and the humerus. Shoulder position is therefore quite important. Bench height and distance should be such that your hands rest comfortably on the keys with your elbows at or slightly above key height. The elbows should hang naturally from the shoulders. So particularly if you are sitting too low, you might find that because you are robbed of your arm weight at the keyboard, you might unconsciously start to raise the shoulders. So what you really should do is be at a height where your elbow is approximately at the same level as the keys. I like to be just ever so slightly higher. Also take care to relax your chest. Open up your posture, and as before, keep that head up. Keeping those shoulders down and back can avoid a lot of problems, including ulnar nerve compression. Another common site of compression is the cubital tunnel, the area of the elbow where your funny bone is. Incidentally, hitting your funny bone is what happens when you accidentally bump your ulnar nerve, so that is actually related. Ulnar nerve compression injuries can happen if you frequently bend or lean on your elbow. Sitting too high or too close is an example of the sort of posture that could lead to this sort of problem. When you sit too high, the keyboard does not adequately support the weight of your forearm. This means that your upper arm has to do that work, which means that it is holding your elbow joint in a bent state actively. So you're fixing your elbow in a bent state as opposed to resting your hand on the keyboard in a way that keeps the elbow passively bent. The same is true if you're sitting too close. When you put your elbows behind the body, it has that same effect of removing weight from the keyboard. You feel less supported and you start engaging the muscles that bend your elbow. The effect is the same. You are actively holding your elbow in a bent state in a way that promotes tension, and these are the sorts of positions that can eventually result in ulnar nerve entrapment. The forearm should feel completely supported without feeling like you have to maintain a bend in the elbow. The keyboard should support it, and you should be at a height and distance where the muscles of the upper arm can stay completely loose. Lastly, wrist position is very important to nerve health. Twisting at the piano, or ulnar and radial deviation, is a common cause of ulnar nerve compression and injury. Too high or low wrist can also be a problem, usually more for the median nerve, but also for ulnar. So what you want is to keep your wrist within a healthy range of motion that sticks as close to its neutral position as possible. By following the basic tips of taking care of your head position, your shoulder position, bench height and distance, and wrist position, you will go a long way towards protecting the health of this vulnerable nerve. Awareness is key. If you exhibit pain at any of the sites we mentioned, or if you notice numbness on the pinky side of your arm, hopefully this video gives you a checklist of things to look for to address the problem. As always, if you are dealing with an injury, it is important to seek medical attention and physical therapy if necessary. Thank you for watching, and until next time, happy practicing.